Good morning, ma'am. So, I'm Anjik P. Cuba, and I'm from BSN 1E. So, I'm going to demonstrate the assessing for the heart and neck vessels. So, first, we're going to introduce ourselves to the patient. So, good morning, sir. So, I'm Anjik P. Cuba, and I will be your student nurse for today. So, I will be the one who will assess you on assessing your heart and neck vessels. So, can you please state your name, sir?
My name is Justin P. Makalalan.
So, how old are you po?
My age is 15.
So, when is your birthday po?
November 13, 2006.
Okay, so after that is we're going to explain the procedure to the client. So, sir, ang purpose po nito is for us to be able to know if there are any abnormalities that we can observe and inspect to your heart and neck vessels. So, after that, we're going to provide the patients with the privacy. So, if the door is open, we're going to close it. And also the curtains and windows, if it is open, we're going to close it. So next, we're going to perform a hand hygiene. Next is we're going to prepare the client to a comfortable position. So sir, comfortable position naman po kayo. Okay naman po kayo. So after that, we're going to collect for the subjective data. So, sir, I just have some few questions to ask po. I hope you can cooperate with me. So, sir, do you feel any chest pain?
No.
Hindi naman po. Palpitations?
No.
Okay. Dizziness? Previous heart problems like heart defect, heart attack, na heart attack na po kayo? Napa-heart surgery na po kayo? Hindi pa naman po. Or cardiac intervention? Na hypertension?
No.
Hindi naman po. So, myocardial infarction?
Hindi naman.
Elevated cholesterol?
No.
Nagsisigarilyo po kayo, sir? Nag-inom po kayo ng alak?
No.
So, use of medications or treatments for heart disease, gumagamit po kayo ng mga gamot, uminom po ba kayo? For heart disease, hindi naman.
Hindi naman.
Sa yung ibang gamot. So, we are done with the collecting of subjective data. So, now is we're going to collect for the objective data. So, first, we're going to gather all the equipments that we will be using. So I have here a watch with a second hand, a pillow, a stethoscope with a bell and diaphragm. So pen light, so let's just pretend that this is a pen light because I don't have that kind of equipment. And the 2 centimeters ruler. So again, explain the procedure to the client. So sir, ang purpose po nito is for us to be able to know if there are any abnormalities when we are observing and inspecting for your heart and neck vessels. So next, we're going to ask the patient to put on a gown. So when assessing, we are going to ask the patient to put on a gown, so we're going to assess the patient. So sir, upo muna po kayo. So suot niyo po ito. So, pwede na po kayo sa humila. So, after that, we're going to assess for the physical examination, or we're going to collect for the objective data of the heart and neck vessel. So, first, we're going to assess for the patient's neck vessel. So, first, we're going to auscultate for the carotid arteries. So, using the stethoscope, so we're going to auscultate. So sir, auscultate ko lang po yung carotid arteries niyo. So when auscultating, note or observe for any abnormalities like vibrations or any abnormal sounds. Kabila na. So next, we're going to palpate for each carotid arteries for amplitude and contours of the pulse. So sir, palpate ko lang po yung carotid arteries niya. So note any abnormalities when palpating. Note for any abnormal pulsations to the patient's carotid arteries. Ang kabila naman. So next, we're going to inspect for a jugular venous pulse of the patient. So using this pen lights, we're going to inspect for a jugular venous pulse of the patient. So sir, inspect ko lang po yung jugular venous pulse nito. So note for any observations or abnormalities. So sir, lagay lang po ako ng kilaw side niya, sa ulo niyo po. So this lang. Okay. So note for any abnormalities when assessing or inspecting the jugular venous pulse of the patient. So after that, we're going to measure the patient's jugular venous pulse. So using this 2 centimeters ruler, we're going to measure the patient's jugular venous pulse. So sir, measure ko lang po. Kabila naman. So we are done of the assessing of the neck vessels to the patient. So now we're going to assess for the patient's heart vessels. So first, we're going to inspect for visible pulsations. So inspect for visible pulsations. So next is we're going to palpate for the apical pulse of the patient for the size, strength, location, and duration of the pulse. So we're going to palpate the apical pulse of the patient. So note any abnormalities when palpating. Note for any abnormal pulsations. So next, we're going to assess or palpate for the apical pulse for the abnormal pulsations or vibrations to the apex, to the left sternal border, and base. So sir, can you please magilid na muna po kayo. Assess the patient. So we're going to palpate for the apical pulse or for the left sternal position. So observe for any abnormal sounds or pulsations and also vibrations. So next, we're going to auscultate for the S1 and S2 heart sounds for the location and strength pattern. So we're going to auscultate for the pulmonary, for the aortic, for the tricuspid, and for the mitral area. So we're going to auscultate na. So note for any abnormalities or abnormal sounds Try to speed naman. And sa mitral. So next, we're going to auscultate for the extra sounds like murmurs, clicks, and grabs. So we're going to auscultate for the extra sounds. So I'm going to use this diaphragm first, then the bell. So note for any abnormal sounds like murmurs, clicks, and grubs. So next, we're going to auscultate for the patient's left lateral position, and also the client sitting up, the client leaning forward, and the client exhaling. So sir, I'm going to auscultate for your heart. So sir, can you please tagilid naman ako? So we're going to auscultate for the patient's heart. So note and observe for any abnormal sounds. So sir, pwede pong umupo kayo. Next, for the client sitting up, pakispilit ng puso. Okay, lean forward po sir, lean forward dito. Okay. Straight na po sir. So, pwede po sir kayo mag-inhale, inhale, exhale. Sama po sir, inhale, exhale. Okay, so note for any abnormal sounds. If for any abnormal sounds na pwede natin observe, like murmurs, vibrations, clicks, or rubs. Okay. Ganda po. So, we are done with the assessment of the heart and neck vessels. So, next, we're going to document all the data that we've gathered, if ano yung mga na-observe natin or na-inspect natin sa patient's heart and neck vessels. So, we're going to document it. And also, if what is the procedure that we do. So, kasi if we don't document, it is not done. So, document. So, after care of the equipment, so, liligpit natin yung mga ginamit natin. Okay. So, next is for the aftercare of the patient. So, sir, upo muna po kayo. So, assess the patient when removing the gown. So, ano po sir gusto nyo? Nakahiga po o nakaupo? Nakahiga po. Okay. Ganun po. So, next, we're going to perform a hand hygiene. So, we are done with the procedure or written demonstration for the assessment of the heart and neck vessels. Thank you.